Hi, I'm Martie Salt, and you're watching WFTV.com's Care Connect. Brain bleeds are a relatively rare but very serious condition that can happen to anyone. Here to tell us more about brain bleeds is HCA Florida Osceola Hospital neurosurgeon, Dr. Amade Bregy. And welcome, Dr. Bregy. Thanks so much for being with us.
Thank you for having me.
What exactly is a brain bleed?
A brain bleed is a condition where a blood vessel in your brain bursts. This can be an artery or a vein, and it can lead to a very critical condition. This can be a life-threatening condition, and immediate medical attention is needed.
And what causes brain bleeds?
Various conditions can lead to a brain bleed. In patients under 50 years of age, the number one reason is usually trauma. This can be
an accident or something.
Exactly. This can be a motor vehicle collision, fall off a roof, or anything. Then patients of any ages can be affected. Even children can be affected. There are even reasons like pregnancy or hypertension that can lead to bleeds. But other common reasons are also abnormal blood vessels, such as aneurysms or other types of vascular malformations.
And how are they treated? Is surgery always the first option?
Not necessarily. So it depends a little bit on the type of bleed and the cause of the bleed and the overall condition of the patient. At HCA, the first step is to evaluate the patient neurologically to see what type of exam they have, neurologic exam. And then we take the patient usually to a scanner, a CT scanner. We do imaging, and that defines where the location is of the bleed. And when we take all of these factors into consideration, that then defines usually what type of treatment is necessary. Whether we just manage these patients with medical management only and serial imaging, or whether these patients, for example, have to go emergently to the operating room.
For symptoms, what should you watch out for?
There's a wide range of symptoms that can be or hinting to a brain bleed. Some of these symptoms can be a devastating headache that is the worst headache of your life. But it can also be a seizure, altered mentation, or focal weakness, where someone can't feel or move one arm or one leg or one side of the body. If such a condition should arise in yourself or in one of your loved ones, please call your doctor or 911 immediately.
Right. So what are some of the advances in treatment that you're seeing that you're encouraged by?
A lot of the most recent treatments, they gear towards minimally invasive and computer-steered treatments. Especially in aneurysm treatment, there are endovascular procedures that most of the aneurysms are nowadays treated that way. And that's less invasive for patients, and patients usually have a much better outcome. And also in terms of imaging, there's a lot of advancement that has been made over the last couple of years. When patients undergo initial scans, there is even AI nowadays that analyzes the images automatically, and if AI detects, for example, an occluded blood vessel, which is happening in a stroke, or it finds a bleed, then there's an automatic detection for that.
And research is going on all the time. Things are changing all the time. All right, thanks so much, Dr. Bregy. And if you would like to learn more on today's topic, please visit HCAFloridaHealthcare.com. I'm Martie Salt, and thanks for watching.